HIV prevention medication is gaining more attention among people at risk, but also doctors.
Now local chapters of Planned Parenthood have the option to prescribe it to patients who may need it. KXAN's Steffi Lee explores why they added the service.
Just fits in perfectly with our mission.
Dr. Amna Dermish with Planned Parenthood of Greater Texas says offering HIV prevention drugs could help meet a need. One's a pill called PrEP, pre-exposure prophylaxis, a daily pill taken to reduce HIV transmission.
It's a common misconception that PrEP therapy is really only needed by men who have sex with men or in the LGBT community. And as a matter of fact, 1 in 5 new acquisitions of HIV are among women, and particularly women of color are at high risk.
Health centers are also offering post-exposure prophylaxis, or PEP, taken to reduce transmission after exposure with a high-risk partner.
Part of our goal is to really educate people and to reach out to communities who are at risk and may not realize it.
Southern states of the U.S. account for over 50% of new HIV cases, but yet they only account for about 30% of people who are on PrEP.
AIDS Services of Austin says the cost, pushing into the thousands of dollars, isn't the only problem.
Because people don't talk about sex and they don't talk about how to prevent HIV or STIs, therefore they're not aware that there is this medication.
Their clinic says as there's more awareness about the drugs, it's up to all physicians to prescribe responsibly.
It has to be based on people's risk.
And that was Steffi Lee reporting. If it's determined that the patient is at risk for acquiring HIV after a screening, the doctor will discuss their medical history and do a test before prescribing PrEP. AIDS Services of Austin will start offering PrEP and PEP in August when their new medical clinic opens as well. And city data shows that almost 1,000 people living in Austin right now have HIV but don't know it. That's why city leaders are making changes. Last month, Austin became the second city in Texas to join an international agreement committed to end the AIDS epidemic by 2030. The goal means 0 new AIDS cases, 0 new HIV infections, 0 HIV-related deaths. But also, the city wants 90% of people living with HIV to know their status and receive sustained treatment.